Okay.
Okay.
All right. So thank
Morning.
you for joining us. This is the first in our 2025 series on the 4 M's of age-friendly care. And I'll just briefly list what the 4 M's are. We have mobility, which we're going to talk about today. We have medication, so making sure our patients are taking their medication safely. We have mentation, which is checking to see how our patients are doing with things like cognition and memory. And then we have the fourth M, which is what matters. So making sure that our patients are able to make informed decisions that really connect with their own values. So I am thrilled today to introduce our guests. We have Tai Chi Mike Gentile, and we also have Emma Dixon. And I'm going to let Tai Chi Mike get started. And Mike, if you can just share a little bit about yourself and how you got started into Tai Chi, and then we'll get going with our demonstration and participation today.
Thank you. So I'm Tai Chi Mike, and actually I started Tai Chi 40 years ago, and I was 40 years old. So I just celebrated my 80th birthday. I was looking for something that was peaceful. I was in the martial arts, and Tai Chi is known to have meditative aspects. So I joined an organization called Stillness in Motion, and the form that we teach here at Atrium is the first form that I ever learned in Tai Chi. So after 40 years of practice, I finally got it. Now, because you're a beginner for Tai Chi in 3 years. So that journey changed my life. 10 years later, I quit the electronic distribution business and I became a full-time Qigong Tai Chi instructor. And that was my vocation. And then 2001, I moved down here to be closer to my son. And now I have 3 grandsons and they've just finished college and all this good stuff. So it's a pleasure. I've been working at Atrium for quite a while, and it's a pleasure to introduce a healing modality that some people are not familiar with. That is a total system from a meditation to a martial art and anything in between. And today, with the help of my nice students, we got Dr. P and Emma and Jill, we're going to go through some basic moves. So this will be like a Tai Chi basics type of introduction to what we do. And then we go from here. Okay. No
That
cues.
sounds great. So I am excited to see Jill and Emma and Dr. P learn a little bit more about Tai Chi. And looking at you, Mike, I think we all should be doing Tai Chi.
Thank you. Thank you. Thank you. It does work. So yes, like any kind of movement. So by the way, in reference to a little bit to the M's, Tai Chi is called meditation in motion. It's also now called medication in motion. A lot of the hospitals have coined that phrase. And one of the aspects, which we'll get into a little bit today, if you're in the moment with your movement on everything you did, like a hobby, people can relate to hobby if they're doing music or gardening, that clears the monkey chatter. When we're going through stress, illnesses, we have lots of fears and things of that nature, and rightly so. And it's important. So the meditative aspect of Tai Chi, and actually it's a term called Qigong, Qigong. First thing to learn that Qi is pronounced Qi. And it's a Scrabble word. Okay? So you can really use this kind of stuff. That's energy work, working with your energy. So a lot of the things we do in Tai Chi and a lot of the health benefits, the medical benefits referred to as Qigong. Tai Chi would be considered the martial art of Qigong. So let's do some things, okay? So line up a little bit and just take a look into the mirror. And we start out in what's called Bu Chi. So Tai Chi is continuous motion. Bu Chi is the meditative aspect of stillness. So take a moment, take a breath. Make believe you got stuck in traffic. You finally got here. Let out a big sigh. We don't know sometimes we need a sigh. We don't even realize we need a sigh, right? Okay, now We're going to harmonize. Just for a minute or so, we're going to harmonize the body, the breath, and the mind. So first the body, relax the arms, and don't let the arms touch the body. Eventually, you have a nice aura around you. It's called Pong energy, and you'll kind of rest the arms, right? Nice and simple. Soft knees. You're balancing a little book on your head to help your posture. Your eyes are straight ahead, and close them for a moment. If you get lightheaded, obviously open them up. And just for a moment, see how you feel. You have nothing to do right now, just be. And most of the time, we don't spend too much time just being. Then focus on the breath. If you're an experienced breather, you'll breathe in and out through the nose. But if you want to breathe in through the nose and out through the mouth, picture the tide coming in, the tide going out, soft. It's not a long breath. You don't need to count or anything of that nature, really soft. And then if you put your mind on the breath, you hopefully will ease the mind. Peaceful. Have a peaceful mind, a happy mind. One of the ways you get a little happy mind is put a little smile in the corner of your lips. That's a good way to start. And then open the eyes. And we're going to do a little simple qigong called breathing, harmonizing the three treasures. Okay, so I'm going to face here. So your hands will come up at 10 and 2, like so. So lift them up and then exhale out. Letting go. Breathe in, the center line of the body, and exhale down. And then sink a little bit into the legs. Pumping the legs all the time. Pumping of the legs helps the circulation, strength, and activates the lymphatic system. No? So in breath, and then an out breath. In breath. So the big difference, one more time, between Qigong exercises, Tai Chi, is connecting the breath to every movement you do. That helps the blood pressure, keeps the tension down, and so forth. Nice. Let the hands relax. So when you let the hands relax, see if you can feel now the qi and the blood flowing to the hands. You can see they got red already. Okay, so Tai Chi, from the first time you do it, will increase your circulation, which definitely helps us in our immune system. Right? Now, when we lift, we try not to use the shoulders. So just bring the hands straight up and down for a moment. Tell you what we're talking about. Our job is to get the job done with the least amount of effort. Least amount of effort. So if you were painting, had a little paintbrush, and you were painting the brush, your wrist would go up and down. Not that kind of thing, right? So one more time. Breathe in and breathe out. Nice. And then we start with the feet together and a big smile. That's how we start our Tai Chi. But only in Tai Chi Mike's Tai Chi. Good. Good. Now, so the mobility factor of Tai Chi is designed, but one of the forms that we teach here at Atrium is called Dr. Paul Lamb's Tai Chi for Health. That was designed in Australia and the United States. The Arthritis Foundation got together in England and came up with this form to help people with all their joints. So our movement of joints is gentle, and then there's no reason to be fast on something. So we would be slow, but we would rotate the wrists on every class, the elbows, the knees, the ankles, neck, right? So by the time you're through with the class, and hopefully a little bit before you came in, you loosened up a little bit. So we're going to walk through the Tai Chi form, or just part of it. So we're going to take a minute or so. And that'll show you that by walking and learning the form, which is the tool to help us get stronger, and then the form eventually becomes the meditation in motion. Now that also keeps us safe. So meditation, being in the moment to us, is our main job is to keep people from falling. Everyone thinks they fall because they have a balance issue. Well, to some degree, that's true. But 90% of the falls that we find is we're rushing, we're distracted. That combination is a problem. So we have a turtle. slow and steady, and live to be 100. Okay, so that's my goal, right? Okay, so and of course one of the ways to keep people from tripping, especially seniors or people with MS or Parkinson's, is the ability to pivot. So like a dancer always moves from the bottom. Most people, though, when they get up and turn, they move from the top. They use, and especially if they're strong and big, they use the upper body. The ladies are much better by being rooted, and they use the lower body. So if a man pushes a couch, he goes like that. A woman goes, oh, the couch goes flat, right? So they know how to do that. So we're going to walk through the form. This is called Embrace the Moon, Yan style Tai Chi. Now come over a little bit this way because we're going to take 3 steps to the left. And then you kind of get a little idea of what we're talking about. All right, so first, you start out with a smile. So if we're not waking up with a smile, we're missing something. Right? And we step to the left. This is called the commencement. And up and down. And what we're going to do is pivot on the heel. We teach people how to pivot. We shift our weight. We're going to hold this big ball with the right hand on top. Pick up your left heel, step to 12 o'clock, and then we're going to do what's called the ward off with the left hand. And eventually you'll know the names and it'll make sense, right? Now we're going to grasp this big bird. We're going to roll back and put the bird down like a pheasant's tail. These are the oldest movements in Tai Chi Chuan. Okay? And we're going to press. Then we're going to wipe off the table. Now, it's a martial art too, so we're going to push our opponent. Exhale, out the window. Watch him fly. In Tai Chi, you never lose. And we come up. This is called Embrace the Moon. Very nice. You can see the coordination factor. You can see how all the joints get moved. Okay? And we're going to stand for a moment like a stork. Nice. Now, this is one of our, we do standing postures. So on a higher level, this is a 20-minute stance. Okay? But for senior discounts, we do like 10 seconds right now. So now we make a beak, shift back, pick up a piece of pie over here, turn it, and everything's over at 10 o'clock. Nice. And we feed this hungry person the pie. So we smush the pie. Right. Now come back. We're going to do wave hands like clouds, which is a challenging movement. You step to the left, wave hands like clouds. Yeah, nice. Both hands are moving. One's clockwise, one's counterclockwise. And this one takes a while to learn. When I mean a while, sometimes months, okay? Especially if you only come in once a week. And then we finish by stepping to the left, drop the hands, pick up a little chi ball, put it down, back to center, up and down, left foot by right foot, and then you finish with a smile. And if you want to do a little Tai Chi bow, it's left hand over right, left toe in front, and a little. All right, shake it out of it. Okay, rub your legs. You see what time goes fast when you're having fun, right? Okay, we've got another 5 minutes or so, right? So coordination, balance, so we awareness, proprioception in space, right? We want people to not, if people, how we reach like that, you take Tai Chi long enough, you won't reach anymore. You'll just close it, right? You'll learn to use the legs instead of the bend, especially if you got back issues and things like that. And all of us have issues. So a lot of the men that come into my classes are ex-military, ex-football player, who's got hip trouble, who's got, those kind of things. And they normally come to me at around 50. But most of the Tai Chi audiences in the United States is female because they don't mind doing something different. And they don't mind taking a while to learn. They don't expect to learn it right away, right? That kind of thing. So we also do simple things, right? So things that help us relieve the tension in the body or the mind or the fears and so forth. And one of them is called breathing to the 4 corners. So let's just do that real quick, okay? Well, Tai Chi quick. So breathing to the 4 directions, we're going to just do one. We normally do sets of 3. This gives you a lot of smiles. So that we have inner smile concepts. You smile to the heart, you bring in chi, you bring in ki or prana, whatever people are calling it, and you bring in blood flow. And these things are beneficial. Okay? So there's a whole concept of the 5 element theory, so that's that's called Nigong, internal Qigong, right? So this here is bring a smile to your face. And then exhale. So you're outside, you're looking at the horizon, exhale away. Bring a smile to the heart. You might take it for work, right? Got some troubles today? Send them up. Breathe in again. Back to the lung area. Stretch out slowly. Give yourself some space. Now you get a hug from the universe, right? So if somebody's home, they can just kind of stand here, nurture themselves, right? Put their hands in the heart center. But in the form, we would just kind of come in and we would exhale down and let the hands relax. Let's just do that one more time. In breath. So mind intent, very important. In breath, out breath. Let it go, whatever it is, right? Each one of these movements have eventually a sound to it, connects with internal organs, and down. One other thing, hold the little chi ball. Just hold it there for a minute. Okay? And eventually you will feel the ions in the air. Okay? So you'll feel the energy. And we do some easy routines that help you get there. Okay. So like sometimes if you just pulsate it a little bit, some of us will feel some warmth or tingling or whatever. But for now, we're talking about mind intent, we have what's called the happy ball. So everyone leaves the class with their own happy ball. So in other words, if you go open and close, very simple move. This is in the Dr. Paul Lamb's form. So that's easy enough, right? In breath, out breath helps people move, relaxes them. The mind is busy with their body instead of their worries. But if you say to yourself, oh, so happy, so happy, so happy. One of my teachers was William C.C. Chen, who lets you use his voice to open and close, right? So he looks at that as a compliment. And if you say it out loud, oh, so happy, so happy, so happy, it changes air. So anytime you're about to get into a discussion, you have to do 3, oh, so happy balls. It will change the outcome of your discussion or the beginning of the discussion, right? So we need to get the politicians to do this. And then we finish with a nice breath, getting ready to take on the day. Better circulation, right? With hopefully a better attitude. We rub the hands a little bit. We get all kinds of little tapping and rubbing, pressure points, and it goes on and on. That's it. Thank you. Yeah. Great audience. Thank you. Well, normally we want to. So.
Thank you, Mike.
Thank you.
You guys were looking good there. Awesome. All right, we're going to make a little bit of a shift, and we're going to have Emma Dixon, who was our exercise specialist here in the Department of Supportive Care at Levine Cancer. Emma's going to share with us some other ways to keep moving and stay upright and healthy. And so, Emma, I'm going to let you go ahead and tell a little bit more about yourself and then what you need us to do.
Sounds good. Well, my name is Emma. I'm the clinical exercise physiologist for the supportive oncology group. I'm very happy to be here today to talk to you a little bit about mobility and why physical activity and exercise are so important for you. As Mike said, movement is medicine, so I really just want to get a little bit more into that. So we will go ahead, and I have a little presentation here that I'm going to click through and speak to you about. So today we're going to try to increase your awareness and understanding of mobility and the 4Ms framework that Susan talked about previously. We're going to learn about the consequences of your mobility declining and how to improve your mobility and physical activity. So first of all, let's talk about what mobility is. Simply put, mobility is just the ability to move and walk freely and easily. As you age, mobility tends to decline due to things like decreased muscle mass and strength, decreased endurance, losing your vision, and losing some proprioceptive function like Mike talked about just a second ago. So why do we care if our mobility is declining? Well, mobility is directly linked to an increased risk of falls. It's linked to decreased physical activity, increased risk of chronic disease, and decreased quality of life. So we're going to talk about each one of those a little bit individually. So talking about increased risk of falls, just some stats for you. 1 in 4 older adults over the age of 65 falls every year. So really want to work to prevent that as much as possible because falls are the leading cause of injury deaths for older adults. So how do you determine if you are at risk for falling? There is a questionnaire. So I'm going to read out some of these questions and I want everyone to kind of tally how many you answer yes to. So I have fallen in the past year. I use or have been advised to use a cane or walker to get around safely. Sometimes I feel unsteady when I am walking. I steady myself by holding onto furniture when I'm walking at home. I'm worried about falling. I need to push with my hands to stand up from a chair. I have some trouble stepping up onto a curb. I often have to rush to the toilet. I have lost some feeling in my feet. I take medicine that sometimes makes me feel dizzy or lightheaded. I take medicine to help me sleep or improve my mood. And I often feel sad or depressed. So if you tallied those up and you answered yes to 4 or more, that would mean you are at increased risk of falling. Then we also have some tests that we can do to further assess your fall risk. So one is called the timed up and go. They use this frequently in physical therapy, senior oncology, and things like that. So for this test, you would start seated in a chair. You would be timed on how long it takes you to stand up from the chair, walk 10 feet around a cone, come back to the chair, and sit back down. We want it to take less than 12 seconds to complete that task. If it takes more than 12 seconds, again, that means you're at increased risk for falling. Another test we can do is more so testing your leg strength and endurance. It's called the 30-second chair stand. It's exactly what it sounds like. You start seated in a chair and you stand up and sit down as many times as you can safely within that 30 seconds. And then depending on your age and your gender, there is kind of a number of repetitions we want you to be able to fit in. So for example, if you are 72 years old, you're a man, we want you to be able to do more than 12 repetitions in that 30 seconds. If you are that same age, you're a woman, we want you to be able to do 10 repetitions in that 30 seconds. And then there's different age categories for each. Another test we can do is more of a specific balance test. So you basically take turns standing in different positions. So the first one would be standing with your feet touching side by side. If you're able to hold that stance for 30 seconds without having to hold on to anything, you would move to the next stance, which is a little bit harder, which would be one foot kind of halfway in front of the other. We call that a semi-tandem stance. Again, if you're able to hold that one for 10 seconds, we would move to the next, which would be heel to toe, kind of standing like you're going to walk on a tightrope or a balance beam. If you're able to hold that for 10 seconds, we would move to single leg stand. So getting pretty tough there. We want you to be able to hold that tandem stance, so one foot in front of the other, for at least 10 seconds. If you cannot hold that stance for at least 10 seconds without grabbing onto something or stepping off to the side, that would mean you're at increased risk for falls. So having decreased mobility, having fear of falling, having loss of balance all leads to decreased physical activity levels, which we need physical exercise to help keep us healthy. That's why Mike and I have jobs, right? So according to the American Cancer Society, for anyone older than the age of 65, and for a lot of the population in general, actually, we want to get about 150 minutes per week of exercise that is increasing your breathing and your heart rate. So aerobic activity, sometimes referred to as cardio. So things like walking, chair aerobics, gardening, it can be day-to-day activities, but anything that's getting your heart rate up. Now, if you're working at that moderate intensity where you could still talk while you're exercising, that's where we want that 150 minutes a week. So about 30 minutes on 5 days per week. Now, we also want types of exercise that are going to strengthen your muscles on at least 2 days out of the week. And of course, we want some exercise that's going to improve your balance. So a little bit later on in the slides, we're going to go through each one of those a little bit more specifically and give you some examples of things that you can do. But I want you to take some time to think about what % of the population from ages 65 and older are actually meeting those guidelines of 2 days a week of strength training, working on your balance, and 30 minutes on 5 days a week of cardio. What % of the population do you think is actually achieving that? Get that number in your head. Drum roll. 12% of anyone between age 65 and 85 is meeting those guidelines. And then anyone over the age of 85 is only meeting, there's only 5% of the population that's meeting those guidelines. And then research shows that older adults spend between 9 and 13 hours a day sitting. So lots of sedentary time that we want to try to decrease. So without physical activity, you miss out on a lot of great benefits. I have a little infographic here that I can share with you that gives you kind of a good full scope information. And because of decreased physical activity, we're going to have increased risk of chronic disease. So moving back to our idea of that sedentary behavior and how much time you spend sitting throughout the day, if you have increased sedentary behavior, you're going to be at higher risk of things like cardiovascular disease. So things like high blood pressure, high cholesterol that can lead to heart attacks and strokes. You can be at increased risk for metabolic diseases like diabetes, increased risk of cancer, specifically breast, prostate, bladder, liver, kidney, endometrial, and colon cancer. And then musculoskeletal issues like osteoporosis, arthritis, which is super common, loss of muscle, which is called sarcopenia, and increased risk of bone fracture, especially if you're at risk of falling. And then in addition, you're at increased risk of mental health issues like depression and anxiety. So physical activity can help improve your lung function, your heart function, and your metabolic function through things like decreasing your blood pressure, decreasing your triglycerides and your bad cholesterol, which is your LDL cholesterol. It can help increase your good cholesterol, which is your HDL cholesterol, that can help clear your arteries of plaque and help prevent heart attack and stroke. It also reduces your likelihood of getting any of those clots forming in the first place. It increases something called your VO2 max, which is your ability of your body to take in oxygen and use it, which can help with your endurance. So making sure you don't get as tired going up the stairs or going for a walk, carrying your groceries in, things like that. And also, physical exercise can help increase your insulin sensitivity. So it makes your body more able to take the sugar that's in your blood, move it into the cell, and then use that as energy for your body, which will decrease your blood sugar and help prevent diabetes. And then overall, exercise just helps it reduce your likelihood of getting those chronic diseases that we talked about previously and decreases your likelihood of death or mortality. So all the good things. And then just a decreased quality of life can result from having lack of mobility, lack of physical activity. So think about all of the things that you do every day that would be made much harder without being able to get up and walk freely and easily. So things like any hobbies that you enjoy. If you like gardening, you might not be able to get down on the ground, do your gardening, pull your weeds, and stand back up again. Things like going to visit your friends and family. If you worry about falling and you're in a crowded airport, that might stress you out. You might not be willing to go visit your friends and family. And just improving your sleep and your energy levels. So think about all those things you do every day and how mobility would impact that. There was actually a study done recently on comparing individuals' quality of life and how far they could walk in 6 minutes, so a 6-minute walk test. And it found that when you're able to walk farther in that 6 minutes, it's actually correlated with a better quality of life. So what can you do to improve mobility? First, we want to make sure that you're exercising safely. So just some precautions, make sure that you're exercising in a safe location, make sure someone knows that you're exercising, especially if you're just starting out. Make sure you're only doing exercises that aren't increasing your pain, and make sure that you're not having any signs or symptoms of like chest pain, dizziness, trouble breathing, or shortness of breath, things like that. All right, let's get into the fun stuff, actual exercise. So aerobic physical activity, I kind of touched on earlier. That's that 150 minutes a week that I talked about. It's anything that gets your breathing harder and your heart rate faster. So things like a walk, riding a bike, riding a stationary bike, water aerobics, swimming, chair aerobics, you name it. You pick something you enjoy and try to get your heart rate up. We always want to start working at a light to moderate intensity if you're just getting into exercise for the first time. So you should still be able to talk while you're exercising. We also use a rating of perceived exertion scale sometimes. So on a scale of 0 to 10, where 0 is you're asleep on the couch and 10 is you're running a marathon, you want to be in the middle. You want to be in the Goldilocks zone. So that's aerobic exercise. Now, muscle strengthening is that 2 days a week that we talked about previously. We want to choose exercises that work all your major muscle groups at least once per week. So this can be things like using stretchy bands, resistance bands. It can be using light hand weights. It can be doing things like Tai Chi, lots of different options for strength training. We want to start with about 8 to 12 repetitions, again, feeling like you're working at that moderate intensity. So you feel like your muscles are getting a little fatigued, but we're not going to that all out failure. You want to have some gas left in the tank, essentially. So that is strength training. And we have some QR codes here that I'm happy to send out. I'll have my email at the end of the presentation. You can reach out to me and I can send you some videos. We have beginner muscle strengthening videos, intermediate, and advanced. So the beginner starts with just seated exercise, not having to use any equipment. And then the intermediate and advanced will use some resistance bands so you can learn how to do those safely. And of course, balance. We want to talk about the 3 different types of balance systems that help with your balance. So first off is vision. If you close your eyes, you're going to have a harder time balancing because you can't take in the environment around you. Proprioception, which we touched on briefly, is just your body's ability to sense where it is in space. So especially if you have neuropathy from any type of chemo treatment that you have, or neuropathy from diabetes, that can affect the ability of your feet to kind of sense where they are on the ground, and that can affect your balance. And then your vestibular system, which is kind of in your inner ear, and the fluid that's located there moves around to help your body sense where it is. So those are the 3 different ways that we keep our balance. Some other factors that affect balance are strength, having strong muscles, especially core muscles, leg muscles like your hips, your knees, and your ankles. Having flexibility, so sometimes being tight in your ankles and your knees, your hips and your core can affect your ability to have nice posture and stay upright. And then endurance, if your muscles get tired really easily, you're not going to be able to balance as well. So an example I like to use is if you are walking upstairs and your hip flexors start getting tired, you're not going to be able to lift that knee up as high, and you might catch your toe on the stair, and that might cause you to fall. The balance training, a good example is actually the test that we went through earlier. So just standing in those different stances that get progressively more challenging. So starting with the feet together, trying to hold that for 30 seconds, then doing the semi-tandem, 1 foot halfway in front of the other, then doing the full tandem, 1 foot completely in front of the other, and then standing on 1 foot. So that's something you can do every day while you brush your teeth. Just make sure that you have somewhere to hold on to just in case you were to lose your balance. So that is static balance. We also want to talk about dynamic balance. So things where you are moving through space. Again, Tai Chi is a good example of this. Any type of side to side weight shifting, marching, bringing those knees up nice and high and balancing on 1 foot at a time. Heel to toe walking. So pretend like you're on a balance beam. Do that semi-tandem stance, take a step, heel to toe. And then again, just static balance are all good ways to practice your balance. So some flexibility that we can work on to help our balance would be specifically stretching the ankle. So if you stand in kind of a lunge position and you really think about driving that back heel down toward the ground, that's going to give you a nice good stretch in your ankle. You can sit in a chair, stick one leg out straight, sit up tall, and then hinge at your hips until you feel a stretch in the back of your legs. That's going to be good for those hamstrings. And then making sure you stretch your hips and your trunk. So you could lay on your back and practice bringing one knee in toward your chest at a time to get those hips and trunk stretched out. So in summary, motion is lotion, rest is rest. That's my favorite saying. We want to make sure that we're preventing falls, so you can go through those fall risk screenings that we talked about. If you have any questions, definitely ask your doctor. See if you need a referral to PT. Ensure that your home is safe. Sometimes even just having a rug might make you slip and fall. So think about those things that you have at home that might put you at risk, and just discuss other modifiable risk factors. We want to make sure that we're moving safely. So make sure that you are confident in your exercise, that you know how to do it, especially with things like strength training. There are lots of resources here at LCI, myself included, Mike included. So again, I'm going to have my email. I'll read it out to you at the end in case you want to use that and send me any questions or information. And then, of course, staying active, trying to get that 150 minutes a week of moderate exercise, where you're getting that heart rate up at that moderate intensity where you can still talk. 2 days a week of strength training, just trying to work each major muscle group at least once. And then incorporating some balance and stretching exercise as well. All right. So email, in case you have any questions, is Emma, E-M-M-A, period, Dixon, D-I-X-O-N, @atriumhealth.org. That way I can send you some of the information that was on the slides that you weren't able to see. All right. I think that is everything. Thank you.
Great. Well, thank you, Emma, and thank you, Tai Chi Mike. I also want to make sure that we talk about our next 4M series is on June 11th at 12 o'clock, and we'll be talking about cancer and aging and the brain, so that M of mentation. But we are also recording these sessions too, so that you can have them to refer back to or to do a little Tai Chi practice as well on our LCI Supportive Oncology YouTube channel. I also want to encourage anybody who's looking for more information about supportive care and cancer to go to LCI Supportive Oncology at atriumhealth.org, and we're happy to answer any questions that you may have. All right, does anybody have anything they want to share before we close out?
Zoom, is it on? How do they get to the link to watch the Tai Chi?
Yeah, so it's going to be on this will be recorded and loaded onto our department YouTube channel and live there in perpetuity. But also, Mike, you have a Tai Chi class every Monday. Do you want to talk a little bit about that?
It's at 10:15 on Mondays. People come in around 10 or so we can chat a little bit and create some camaraderie, even though it's on a Zoom. How do they access that link?
Yeah, so anybody interested in learning more about Mike's weekly class of Tai Chi can go ahead to LCI Supportive Oncology at atriumhealth.org, send them an email, and we will be sure to get you all the information you need to register for it. And once you've registered, you'll receive the link.
Yeah, and you can pass on my email, mike@taichimike.com. That anybody can use that. Don't expect an answer right away, but maybe by They'll live on me. Yeah,
Awesome. Awesome. Well, thank you so much.
great.
Yeah, thank you, Emma, for sharing with us as well. And this is all such good information, not just for our older adults, but for all of us really to incorporate into our day. And I'm sad to say I'm not one of those 12%, Emma. So working on it, working on it. Yeah, awesome. Okay, thanks everybody. It's been fun to be with you.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.